Let's switch gears just a bit and talk about another celebrity, Hulk Hogan, who suddenly passed away from a sudden heart attack last week. He was 71. Today, flags are flying at half-staff in the state of Florida in his honor.
That's right. The pro wrestling star dealt with plenty of health issues late in life. On a podcast in 2024, he claimed to have had 25 surgeries in the last 10 years alone. He also had neck surgery just this past March, and he had admitted of using steroids in the 80s and 90s.
So how common, I guess let's start there, is cardiac arrest in somebody in, 71 years of age?
As you get older, it gets more common. So in the 70s, the statistics are about 1 out of 300 to 1 out of 500 per year. Now, if you have a heart attack, which is what Hulk Hogan died of, according to the medical examiner, about 10% of heart attacks, 1 in 10, are complicated by a cardiac arrest. So if you think about what's happening, the heart needs blood flow all the time. You cut off the artery for blood flow, the electrical system freaks out, and the heart essentially stops pumping. Now, the good news about heart attacks causing cardiac arrest, we should not lose somebody to that in 2025, because if you rush them to the hospital, time is muscle, open up that blocked artery, shock them, do CPR, you should be able to resuscitate them. And we shouldn't have people dying from heart attacks from causing cardiac arrest. But in his case, because he arrested at home, it's not clear whether he got timely CPR. It's not clear by the time the ambulance got there whether he got resuscitated, whether or not he had a shockable rhythm anymore.
So if someone is there, and I know we talked about it a little bit last week, but I don't think we can say this enough, especially to our viewers who weren't tuning in last week. What should someone do if they witness that someone is going into a sudden cardiac arrest? What would you tell them right now?
So shake them. Hello, are you okay? Are you okay? Feel up here on their neck to see if you can feel a pulse. Look for breathing, chest rise. Sam, call 911. Alex, get me a defibrillator. And I start doing CPR right away. And if you're just by yourself, you put the phone on speakerphone and you start doing CPR right away. And you wait until somebody comes to get the defibrillator. So don't waste time running away from the victim, looking for help or looking for someone to call 911 or looking for the defibrillator. Start doing CPR until someone else, and you can yell out to someone to come and find you.
Good information.
Yep, and his legacy is so large, you don't think it will be diminished to just his steroid use, but I think we have to kind of at least ask, or I want to ask you, would that play a role?
Very much so. It is known to increase risk of heart attacks and strokes, known to increase blood pressure, known to cause activation of the sympathetic nervous system, in addition to a whole host of other effects. So certainly didn't help here. Heart disease is the most common thing that's going to happen to us as we get older, but you layer on top of it steroid use, having a stressful career where you're performing and you're amped up all the time. These are all contributing factors.
Wow. Well, thank you, Dr. Coley. We appreciate you.